Greetings on the World Homeopathy Day. We welcome you to the second day of the Convention on World Homeopathy Day on enhancing quality of research in homeopathy. We have had a fruitful day yesterday with 3 sessions and 7 speakers. Today we'll have one session in the morning followed by a tribute to Dr. Samuel Hahnemann, whose birth anniversary falls today. Post-lunch today, we'll have a breakaway session, one in the main hall and one session in the side hall. The main hall session will be a prognostic factor research and training through action learning, implanting quality within the researcher. The session is for clinical researchers and practitioners. The parallel session on Indian perspective of regulation of homeopathic medicinal plants is for drug researchers and industry representatives, and that will be held in the conference room. We start with the first session of the day, for which we already have on stage Dr. R.K. Marwa, former Additional Director and Head, Institute of Nuclear Medicine and Allied Sciences, Ministry of Defense, Delhi. Please give him a big applause. And Dr. Raj K. Manchanda, they will be chairing the session. Dr. Raj K. Manchanda needs no introduction. He is Director General of CCRH and has research experience and administrative experience of more than 30 years. And he has been working effortlessly for integrating and uplifting of homeopathy. I would like to call on stage Dr. Kusum S. Chand. She will be presenting her experience on integrated management of chronic diseases. And Dr. Khuda Baksh, he will speak on the present status of gene regulatory hypothesis to explain the molecular mechanism of biological action of homeopathic drugs. I would like to invite Dr. Renu Mittal to present a bouquet to chairpersons Dr. Raj K. Manchanda and Dr. R.K. Marwa. I invite Dr. Anupriya Chaudhary to present bouquet to the speakers, Dr. Kusum S. Chand, and Dr. Anisur Khuda Baksh. I would request the chairs to introduce the session.
First speaker of the day is Dr. Kusum Chand. We all know her very much, but still it is customary to give some introduction. She is from the first batch of Maulana Azad Medical College. She trained herself as conventional doctor, then shifted to homeopathy, did her MF Home after being inspired by teaching at Nehru Homeopathic Medical College. She did her MF Home from UK, and presently she is working in a very reputed, earlier it was known as Pushpanjali Crossley and now it is known as Max Hospital in East Delhi, and is managing with her colleagues over there very, very intricate and difficult cases where she is integrating homeopathy and giving her expertise in that. So, and she had been our guiding force in even our study in multi-drug resistant tuberculosis, where we had to add on treatment with homeopathy and what best is available in that. So I request her to kindly start with her presentation.
Good morning, Dr. Manchanda and Dr. Marwa. I am thankful to the organizers for giving me a chance to speak in this forum. My topic of presentation is integrated management of chronic disease. So we live in an era of high technology and leading a fast life. We live in artificial environment and breathe polluted air. And we eat food laced with pesticides, hormones, and antibiotics. The treatment is with frequent and sometimes irrational antibiotics. So all this has led to emergence of drug-resistant superbugs. Our human body is endowed with powerful self-defense immune system, which reacts with external malefic forces all the time to keep the homeostasis. The malefic forces can be either microbes, changes in temperature, weather changes, emotions, mental or physical stress. Now, this immune system is not constant. It waxes and wanes with stress, and it needs to be boosted in sickness. Homeopathy helps in immunomodulation. See, Bellavite et al., in their work on immunology and homeopathy, they said that antibiotics focus on the immediate cause of the disease, which is the microbe, and homeopathy focuses on the teleonomy of the patient's reaction. So both are complementary. Taking the cue from this, and he said that disease occurs when either the malefic external force is strong or the self-defense immune system is weakened. Multiple factors may be involved in the genesis of the disease. So, taking the cue from all this, an integrated approach to the treatment of chronic disease may be the answer in this era of drug resistance and low immunity. Integration may be between homeopathy and antibiotics, and also multiple homeopathic medicines which are complementary to each other, and they are patient-specific, targeting multiple factors in the teleonomy of the patient may be required for the comprehensive treatment of the patient. Now, I present one case of Pott's poem, which was resistant to antibiotics. This was a 26-year-old female, married female. She complained of backache of 1 year duration, fever for 3 months, and a paraspinal swelling for 2 months. The MRI was done on 7th September 2014, and it showed tubercular pathology. So she went to she consulted the orthopedic specialist, and at that time, her fever was ranging between 102 to 103 degree Fahrenheit, and there was a swelling on the paraspinal, swelling was a cystic swelling. So the treatment was started with AKT4, anti-tubercular treatment, AKT4 plus levofloxacillin. It means 5 antibiotics, and other medicines for pain, for fever, and for dyspepsia. She was also given a Taylor's brace, which was to support the back. And the abscess was drained, and 30 milliliter of pus had come out at that day. Then, 10 days later, she again came to the hospital, and she was admitted with symptoms of gastritis. She was unable to eat anything or drink anything. And both the orthopedic surgeon and gastroenterologist saw her. The fever was still the same. Abscess was again drained. And after 1 week only, 25 milliliter of abscess was drained. The antibiotics were changed to streptomycin and injection Oflox and other AKT4 medicines. And she was advised a X-ray spine. Then after a month, she came for consultation. The backache was increased. Fever had gone higher, 102 to 104 degree Fahrenheit, and she had lost weight. again, the swelling had increased, and they had aspirated 20 milliliter of abscess. So at this point of time, the patient's relatives were very, very anxious, and they sought 2 more opinions from 2 hospitals. One was AIIMS and one was Safdarjung Hospital, and they said that she is suffering from tuberculosis and she has to be given anti-tubercular treatment. Then on 4 days later, she was again admitted in the hospital with symptoms of hepatitis. She had constipation, vomiting, and queasiness. So she was treated for 3 days in the hospital with injections and everything. And then on 6th, she was referred to homeopathy. When I saw her, she was suffering from anorexia, nausea, vomiting, aggravation, eating, and drinking. Fever was ranging between 102 to 104 degree Fahrenheit. And we added homeopathy. The previous treatment, all the previous treatment was continued. It was sulfur 30 biweekly, and tuberculinum 200 weekly, symphytum 30, 4 days a week, means these were all morning medicines. I added Ipecac 6 twice a day before lunch and dinner, and Cilicia 6 in between. And I also gave her Nux vomica 30 and Ipecac 30, a combination for incessant vomiting. And I told the father-in-law that she'll please contact me after 5 days, because I was also very nervous treating such a difficult case and giving medicines. So in between, after 5 days, the father-in-law said that, she is feeling better, in the sense the fever is coming down and she has started eating. So I told him that let her continue with the medicine and see me after 2 weeks. So they came after 3 weeks. The fever had reduced, and she was having now about 100 degree Fahrenheit. She was eating, and her weight had increased by 2 kgs. So I continued. I said, you continue the same treatment, all the antibiotics plus homeopathic treatment, and see me after 3 weeks. So 27/12, again she came. There was no fever, there was no vomiting, paraswelling swelling was very much reduced. It was almost not there. Backache was reduced. She did not need Taylor's brace. So I changed the treatment to Calcarea Phos 30 biweekly, tuberculinum. See, from sulfur I went to Calcarea Phos and rest. But she complained of stiffness of the entire body, particularly the back. So I gave her Calcarea Phos 30 biweekly, tuberculinum 200 weekly, symphytum 30 for 4 days in the morning, and Rustox 30 twice a day. I also asked her to see the orthopedic surgeon. Actually, when the case was referred to me, the orthopedic surgeon has said, when she had come out 3 weeks after the start of treatment, the orthopedic surgeon was very, very surprised, and he said that he left the choice of giving antibiotics to me. He said, if Kusum Chand wants to give the antibiotics, let it be her choice. And we had decided to give antibiotics for a total of 3 months, about 3.5 months. So we had given her antibiotics for 3.5 months. And I had asked her to get an X-ray spine done again, because it was done earlier also. The family was not very keen on getting an MRI done so soon. So he said, okay, we will do the X-ray spine. I said, all right. The X-ray spine on 31/12, 4 days later, showed that it was much better. So I continued with Calcarea Phos 30 BD, tuberculinum, Rustox because of the stiffness, and I added here Cilicia 6 BD and CPR 30 in the evening, because she was complaining of lot of backache and lot of dyspareunia. So now this is the X-ray. The first X-ray shows in the red thing, see there is a space is reduced and there is a fracture of the body of L1 and there is a granulomatous lesion. And the second X-ray, which was done on 27th, showed that there is no evidence of bony trauma or other bony lesion. The paraspinal shadows are normal. So we felt that she is very much better, and the family wanted to send her to her village for a month. And she went there for a So she took the medicine for about 2 months, and she went to her village, but she returned after almost 5.5 months. She still had no swelling, no fever, but she complained of stiffness and pain in the lower back, and so we prescribed the same medicines, and I requested them to do a repeat MRI. So next month they came, and the MRI was done. It showed partial resolution. There was no abscess, and so because there was no abscess, but there was partial resolution. So I felt that the healing had not completed, and she still needed some medicine for bony lesions. So I gave her calcarea phos 30, 3 days a week in the morning, sulfur 30, 3 days alternating with sulfur 30 in the morning, tuberculin 200 weekly, symphytum 30 BD and pulsatilla 30 BD, because both were for bony lesion, ulceration of the bone. And so I wanted to give her more medicines because, for 5.5 months she was not there and the bony lesions were still present. So after and then the same treatment continued for 3 months, and then on 24th September she came. She was complaining of fever and body ache for a few days, and that was the time of chikungunya. So I just gave her Epitorium perfolatum 30 3 times a day for 5 days. And then she came on 7th November, and the MRI with repeat MRI, which showed near complete resolution of bony lesions, but she just complained of slight backache on exertion. So I said that stop treatment after 1 month of the medicines. I'll show the, now this is the first MRI done in September, and it is showing destructive pathology involving D8 to L1 vertebral bodies. See, you can see the destruction, massive destruction in the thing. And the other one, the 1B, shows presence of abscess, that something encircling the spine, the spinal cord, that white thing is the abscess. So it shows pre- and paravertebral and left-sided paraspinal muscular collection of fluid. The second MRI done in June showed partial resolution. The vertebral lesions were better but not gone, with healing at D8 to L1 vertebral bodies and persisting infective lesion at D10, 11, and 12 level. The figure 1D shows that the abscess was much reduced. There was minimal pre-vertebral collection of fluid. The last MRI done in November showed near complete resolution of pathology, healing with healing of vertebrae at D8 to D11 vertebral bodies with persisting discitis, inflammation of the vertebral discs of D12 to L1 level. The figure 1F, the other figure shows no evidence of collection of fluid. Patient was doing well. Even in this March 2017, she came and she was doing extremely well, and she wanted to have to raise a family. She was so well. So 6 weeks of ATT in a clinically and radiologically diagnosed case of Pott's spine had no effect on the outcome of the disease. She had to be admitted twice in the hospital with adverse drug reactions as gastritis and hepatitis. The patient responded well with the addition of homeopathy to the same antibiotics. The antibiotics which were not working earlier had started, I presume she was responding to them. And the fever came down in a week, weight gain of 2 kgs in 3 weeks, 6 kgs in 7 weeks, and paraspinal abscess was resolved. After 1 year, she gained 7 kgs, was leading a normal life, and the MRI showed near complete resolution of the bony changes. Now, case 2 is a case of chronic urinary tract infection, UTI, in a multi-morbid case. This is a 74-year-old married female. She's been diabetic for 20 years, and she's been treated with oral hypoglycemics. HB1AC was maintained around 7, which is a little higher, and she also had complete uterine prolapse for 10 to 12 years, and she had been repeatedly advised surgery, but she was not wanting to undergo surgery. And she also had recurrent culture-positive UTI of 8 years duration, which was treated with prophylactic and symptomatic antibiotics regularly, because she is a wife of a homeopath, and she did not believe in homeopathy, and she was very particular about her treatment with antibiotics because she didn't want the prolapse to be surgically corrected. So prophylactic and symptomatic antibiotics, and also she took infrequent doses of, she was given by her husband infrequent doses of thuja, and for 8 years she had been doing that. She also had associated irritable bowels, bladder symptoms, and hematuria, which were treated with time to time, anticholinergic and antifibrinolytic agents. So at one particular time, she was taking a lot of medicines. So on 1st December 2014, she was given prophylactic treatment. She was prescribed prophylactic treatment